Thank you. Please, I'm really happy to be here. I'm very happy to have been invited. Ça me fait tellement plaisir d'être à Montréal. I grew up in Montreal. It's not my city of my birth, but it's almost the city of my birth. I came here when I was 6. So I'm really thrilled to be here. So I'm going to talk to you about gender differences in schizophrenia. There's a number of differences in schizophrenia. Many of you probably know what they are. Onset age is one of the main ones. Men tend to express schizophrenia earlier than women do. And another one is symptoms. The symptoms are somewhat different. Women have more mood symptoms. Men have more what's called negative symptoms, which are symptoms of apathy and isolation, not wanting to do things, amotivation. The difference in what happens to people with schizophrenia over time, because women do better than men do in all domains: employment, marriage, quality of life. Men tend to do a little bit worse, at least until older age. There's differences in brain structure. There's difference in cognitive deficits, and response to treatment is another. Adriana mentioned it, I think, briefly. Also another difference between men and women. The question is, what do these differences reflect? Do they reflect actual just male-female differences? Because we know that there are, of course, differences between men and women. Or do they actually reflect something more specific to schizophrenia? It's interesting to see that since the dawn of humanoids, there's always been sex differences in height, in head size. But if you notice something interesting over the course of evolution, these have diminished. Actually, men and women are not all that different, at least grossly speaking, as we look at them. They're almost as tall as one another. And the head size, although it's increased from here, it's not that different, again, now from what it used to be. So that's an important point to keep in mind. Okay, so we'll start with onset age, because onset age is the prime difference. It's the one that's been replicated the most in schizophrenia research. So what is the difference? Well, men, which is the green line, there's a peak for both sexes. This is the yellow line for women, but it's a little bit shifted to the right in men. So men tend to, by about a year or so, maybe 2, have their peak of schizophrenia incidence a little bit later than men. The thing to keep in mind is that this is not universally found. It's pretty universal, but it's not completely universal. And there's no difference in familial schizophrenia. But if there's a lot of history of schizophrenia in the family, that this male-female difference doesn't seem to show up. There's also no difference in offspring of older fathers. More recently, it's been found that families with older fathers have more schizophrenia. And this different, if you look at that group of people, there's actually no difference between men and women in terms of age of onset. There is this very interesting, though, second peak. And in this particular graph, it's up here, where just around the time of menopause, there is a sudden increase in women that does not occur in men. So what is the explanation for that second peak? It could be estrogen withdrawal, which is usually the explanation that's given for this. Or it could be a completely different kind of explanation, a more psychosocial explanation, that there's a withdrawal of social supports in older women. And so that older women become, if you want, a little bit more similar to single men, where their social network is relatively narrow, much narrower than it is in younger women, but as women get older, that narrows as well. And that has important implications for illnesses like schizophrenia. Another explanation now, this time for that early peak, why the expression of schizophrenia in men seems to come forward earlier. And that is that men are more exposed to trauma. Obstetrical trauma, we know that. More boys have trouble in terms of birth. but are also early head trauma, as this little boy shows. Boys get into more trouble. They run around, they fall, they fall off their bicycles, they hit each other, and so they get into more trouble. They're more exposed. But not also are they more exposed, but they're actually also more vulnerable. They're more vulnerable to head trauma. And there are several explanations perhaps for this. One of this is that men's brains are more asymmetric. Women's brains are more symmetric. So for instance, Congresswoman Gabrielle Giffords, the bullet, as you know, entered the back, came out in the front. One side of the head was affected. Her chances of recovery are much better because she's a woman than they would be had she been a man, just because women's brains are more symmetrical, so the functions of the other side can take over, whereas in men that is usually much more difficult. Sex hormones play a role in this as well. They play a role in inflammation, immunity, and damage and repair response to injury. So for all those reasons, women are actually less vulnerable than men to injury, and this has been shown in animal models as well. There's another explanation for why perhaps the age of psychosis, of schizophrenia, is brought forward in men, and that is that usually throughout history men have been more exposed to toxic substances, more exposed to substances at work, toxic poisonous substances at work, in the military, but also alcohol, of course, and the current news, the one that we all hear about more recently, is cannabis. Long-term cannabis apparently, according to Reuters, can double the risk of psychosis, and not only can it double the risk, but it can also bring forward the risk of psychosis. However, women are catching up. The rate of cannabis use in women has been increasing in recent decades. So if cannabis really is a prime mover in this, we should see the age of onset narrow in terms of men and women. So what about newer trends in studying gender differences? What's new recently on the horizon? Well, animal models. We were discussing yesterday at dinner how animal models usually are male animal models. It's always easier in the lab to use male rats than female rats for a number of reasons, mainly menstrual cycles. But more recently, there has been more use of animal models of both sexes, both pharmacological models of schizophrenia, genetic models of schizophrenia, and neurodevelopmental models of schizophrenia, which is what this particular reference is about. The thing to keep in mind when you read results of animal studies is that none of them are perfect. They're not perfect. Schizophrenia is considered to be a quintessentially human disease. It's a disease that animals don't have, at least not in the way that we define schizophrenia. So we can study specific networks, pathways in animal models. Very hard to actually study the disease. The other trend, which probably you're all familiar with in the last many years now, is to try and study humans, but to study them early in the process of schizophrenia. So we used to study people here after they had recovered from the acute psychosis, because we can't study them here. They're not competent, of course, to give consent to research. We used to study them here over the chronic course. And at that point, they were medicated, and they were treated. And so the idea was, well, let's not, there are too many variables here. Let's try to study them here, just when they develop early risks, early signs of risk during this prodromal phase. And so more and more what we're doing is we're trying to catch people here and study them here. Of course, the problem with that, the obvious problem with that, is that we don't know what's going to happen to these people. We don't know if they're going to continue that slide into psychosis. They may not. Many of them don't. but obviously some do. So we've studied symptom differences in this early prodromal phase. And what have we found? I mean, it's important to study symptom differences early before people get treated, because antipsychotics can also affect symptoms to large degrees, especially negative symptoms. So the idea used to be, well, yes, men have more negative symptoms, but men are maybe more aggressive, maybe they get more higher doses, and so maybe that's why they're so apathetic. But no, all the recent studies have shown that actually the symptom differences that seem to be seen earlier are also seen in this early group. So early prodromal men and women with schizophrenia, the women also have more mood symptoms. The men also have more negative symptoms, more cognitive symptoms. Women have more positive, kind of delusional hallucinatory type of symptoms. So symptom differences suggest that schizophrenia women are like other women. You know, women have more affect, they have more of, in this diagram, you could call curvy linear thinking than men do. And so the differences that we find in symptoms presumably are differences that men and women have and that are not specific. Not particularly specific to schizophrenia, and maybe don't then tell us a lot about schizophrenia itself. There have been a lot of hormone studies that have been done, both in animals, male-female animals, humans, and these studies are becoming much, much more sophisticated over time. They include molecular studies, they include imaging studies. So we have learned quite a bit about hormones and the effect of hormones, because hormones, of course, are implicated in male-female differences. So some results are that psychotic symptoms vary over the menstrual cycle, that the higher the estrogen levels, the lower the symptoms. The higher the estrogen levels, depending on the course of menstrual cycle, the lower the cognitive symptoms. So that estrogen seems to enhance neurocognitive performance and attenuate symptoms of psychosis in schizophrenia. That's the results so far that seem to be coming out. And we know that actually from other studies too, that estrogen is neuroprotective. Estrogen has neuroprotective qualities.